The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
All right. Thank you guys for attending. Thank you for that introduction. So I'm Dr. Joshua Gonzalez. As our moderator mentioned, I am a urologist and sexual health expert in Los Angeles. I'm excited to go over these injections with you because these are something that I prescribe a lot in my practice. And there's a lot of, I think, poor education done around how to use these injections properly, because when they are used properly, they are often very, very effective and can be used safely and lead to an overall improvement in sexual function. So we're going to kind of first go over how erections normally work before then moving on to how you can use these injections. So what happens when you get an erection? Well, you obviously become aroused, and that arousal sends a signal through your nerves to the penis to essentially become active. That stimulation from the nerves then cause the muscles around the arteries supplying the penis with blood to relax, allowing more blood to go into the penis. This over time causes the penis to stiffen or harden, which is what we call an erection. And as your cavernosal bodies, which are the spongy bodies that fill with blood, as those grow and expand, they lead to compression of the veins, which exist at the periphery of those bodies, pretty much compressing them so that no blood can leave the system. So that allows men to not just get hard, but stay hard during sexual arousal. So what are intracavernosal injections? These are essentially medications that are injected directly into the penis that cause vasodilation. Thank you. Okay, so how do they work? So the increased blood flow basically by causing relaxation of the muscles in the arteries that we just talked about so that blood can rush into your penis and stay there long enough for you to complete sexual activity. These injections come in a liquid form that's injected directly into the penis. And there's a couple different combinations that we use. Colloquially, we call them bimix, trimix, and quadmix. And the name depends on how many of the ingredients listed here are in the solution. So bimix is phentolamine and papaverin. Trimix is those two plus alprostadil, and then quadmix is all three of those with the addition of atropine. I think one thing that people don't appreciate, at least my patients don't appreciate when I'm first talking to them about these injections, is that not all injections are created equal. So I've had a lot of people come to me who have experimented with, a partner's injection, or they were at a party and someone gave them an injection and they didn't really know what they were being injected with. And it's really important to understand that these mixes come in various strengths, and it's really important that you figure out which strength and which dose is appropriate for you. And we'll talk a little bit more about that in a minute. And you can see, MenMD thankfully is able to provide a lot of different strengths. So we can really pick these mixes based on our evaluation of patients in the office and make sure that they're getting a good response, but also not putting themselves at risk using these injections. All right, so let's talk about the needle size and dose volume. So I'll show you this. We'll give you a closer look later, but this is essentially what the needle looks like. Everyone is terrified when I talk to them first about injecting their penis, but what you should understand is we're using very small needles and syringes. The needle is an insulin-sized needle. You do inject it directly into the penis, but at worst, it should feel no more than like a little pinch as you administer the injection. The plastic part of the device here is where the fluid is drawn into the syringe. And then this is the plunger that you use to push the medication into the penis once you've put the needle where it needs to go. And your physician will basically prescribe the right syringes and needles based on what they think is best for you. A couple things to keep in mind. This is often confusing for patients. We use milliliters and cubic centimeters and even the word units interchangeably when we're talking about these things. So, you know, 0.3 mLs is equivalent to 0.3 cc's, but we often in medicine will refer to that as 30 units. And you'll see those various designations on the syringe depending on which syringe you're prescribed. Okay, so how do you pick your dose? So I think the most important thing is that you don't just experiment with these injections on your own, but really seek out a urologist and a provider who is very familiar with these types of injections and this type of treatment. I think best practice is that you should get an injection done in the office. We do that routinely in my office. We give people a test dose to see how they respond. So we then want to judge how good of an erection they get, right? So in the office, if we inject somebody with one of these mixes, we would consider it a good erection if they get an erection that then resolves on its own within usually 3 hours. Sometimes, you know, what we do in the office is not exactly reproducible at home. So sometimes people do have to adjust their dose, and we tell them to take into account how long their erection lasts and how rigid they are. So you want to shoot for that kind of 7 to 9 on the rigidity scale hardness, but you want the erection to resolve on its own, usually within 3 hours. So if you have to actually inject yourself with a reversal, say 3 hours go by, 4 hours go by, and you're still erect, then that dose is too strong for you. And the next time you inject, you should lower how much you're injecting. And conversely, the same is true. So let's say you inject whatever your doctor told you to, and you don't get a 7 to 9 quality erection, or it's not hard enough for you to penetrate or finish intercourse, then we would consider that not effective enough. And the next time you inject, you should inject a little bit more. There's some important things to keep in mind. You don't want to go beyond the maximum dose that is recommended by your doctor. They've chosen that for a reason. In general, we don't recommend that people use these injections more often than once in a 24-hour period. And you know, you really should not be using them more than, say, 3 to 4 times per week. Okay, so we're going to talk about how you prepare to give yourself one of these injections. You're going to need a few things. So you need the medication vial, you need your syringe, which we already talked about, and then you want to make sure you have alcohol swabs. So the first thing you're going to do is prepare the syringe. You're going to remove the cap, which was on here previously, but you'll take this off. You'll take the cap off here. What I tell people to do before they put anything in the bottle is take one of these alcohol swabs and wipe it. All right. And then you're going to basically put the needle in the fluid, turn it upside down, and then draw the fluid into the syringe. And we'll show you this in more detail in a minute. But you want to make sure that you're looking to make sure you're not getting any air in the syringe, that you're tapping the needle, or excuse me, the syringe while the needle is in the solution to get out any air, because you want to make sure there's only fluid in the syringe itself before you inject. Okay. You want to make sure that before you're injecting, that you're cleaning the skin with an alcohol swab. In general, we tell patients to inject, if you're looking at this as a clock, this is your penis, at the 1 to 3 location, or the 9 to 11 location. So it's always on the sides of the penis using your dominant hand. And you want to make sure it's at, roughly a 90-degree angle to the surface of the skin when you're injecting. You want to make sure you inspect the penis. I did my best here to draw a vein on there, and we'll show you this later, but you want to avoid large veins that you can see through the skin itself. And once the needle is all the way in and buried and you can't see any of it, then you push the plunger in slowly until the medication is delivered where it needs to go. You remove the needle, and then you take your hand, wrap it around your penis, and apply compression for 2 to 3 minutes to prevent bleeding and bruising. Okay, so how can we avoid, bad things from happening from these injections? So the first thing is, we already talked about doing an injection in the office with your doctor. You want to go to someone who knows what they're doing. You want to test this out in a clinical setting where if you do get an erection that doesn't go away, your doctor can help reverse it. And that way you can go home and know, okay, this prescribed amount is definitely going to work for me at home because it worked for me in the office. Good practice always is rotating where you're injecting. I always tell patients that they should, at the beginning, always use their dominant hand so that they're making sure that they're giving themselves the injections properly. Once you get used to giving yourself these injections, if you have reasonable dexterity with your opposite hand, then you can switch to using that one and going on the other side. And so rotating the site of injection is helpful at preventing fibrosis or scarring from these injections. And again, as we talked about, you don't want to use these injections for more than 24 hours or go beyond whatever the recommended dose was by your physician. In terms of storage, you want to make sure that you keep these medications refrigerated, and then not use these medications beyond their use date. So the Bimix and Trimix multi-use vials are safe to use for up to 28 days after the initial puncture. Okay. Next slide. There's a couple of accessories that people can use. This is a really important one. You should always make sure you have a sharps container. You cannot throw these needles once you're done using them in the regular trash. It's very easy. MenMD can provide you this, and you just throw the used needle and syringe in there, and you can take it to a local pharmacy once it's full. There's some other devices here. The auto injector is something that your doctor can order for you from MenMD. If someone is really scared of needles, most of the time we can teach them how to do this safely and they're okay to do it, but sometimes people don't even like the sight of needles. I like the auto injector for those patients because they can preload the syringe, put it in the auto injector, and then put the injector device on their penis, push a button, and it delivers the medication for them so that they don't have to actually put the needle inside. Okay, so if you need help or want more information, there's a MenMD personal health assistant who can provide answers and insights to your questions. I definitely recommend checking out the MenMD website. There is a ton of helpful information there for patients, and it's very easy to understand. And then, of course, you can call to ask to speak to a personal health assistant if you have questions about these injections or how you should be doing them at home. So you have your bottle of medication here, okay? And as I mentioned earlier, you want to take an alcohol swab and always clean the top, okay? That's going to essentially disinfect the top. You're going to then take your needle here, and let's say we're going to have this person inject 0.2 mLs or 0.2 cc's, or what we refer to as 20 units. So you're going to draw back the plunger until the top of the black part is touching the 20. You're going to take the cap off. I always tell patients to turn the bottle over, stick the needle right in the middle of the rubber, and push the air out that you had in the syringe into the solution. Now you're going to draw back slowly but surely until you get to the 20. I often will recommend that patients draw back past the designated amount. So we'll go to 30 here. And the reason for that is sometimes you can still get air in there. So once you're past the 20, then you just push out the fluid until you get to the 20. And that's the way that you can guarantee that you don't have any air in the system. Once you're at the designated amount, you pull it out and your needle is ready. So we're going to cap this and then put it down for a second. Now, here's your anatomy, right? So we already talked about how we look at the penis sort of as the face of a clock, and we want to go at 1 to 3 o'clock or 9 to 11 o'clock here, okay? I made a fake vein there. So if I were going to tell my patient where to inject, I would tell them to go right above this so that you're not injecting into that visible vein. So hopefully you can see that. And what I tell patients to do is you're going to take the cap off here. You're going to hold your penis with the non-injecting hand. And I always tell them to put it as close to the skin as they can and count 1, 2, 3, push it in. I like to tell my patients to keep a dimple, maintain a dimple in the skin so that when you're pushing the medicine in, you know it's going into the erection tissue and not just underneath the skin. What I see a lot of patients do is they'll put the needle in, they'll get scared as they're pushing the medicine in, and they start to lessen the pressure, and then the needle, is not where it needs to be, and the injection won't be successful. So if you always kind of create that dimple and apply enough pressure to see a dimple in the skin as you're injecting, you'll know for sure that it's where it needs to go. So now we've given ourselves the shot. You're going to remove the syringe, put it down, take your hand, wrap it around like this is what I tell patients. Some people will say, apply pressure like this. I just tell them to wrap their hand around their penis like this and hold pressure for 2 to 3 minutes. What that's going to do is it's going to prevent bleeding from happening where you gave yourself the puncture site, will prevent bruising. We also think it helps to prevent fibrosis in the long term. So fibrosis is scar tissue that can form after, people do many of these injections. If they're not doing them correctly over time, they can develop little scarring, and that can sometimes make these injections less effective. So if you're practicing, the injection technique, the holding the penis for 2 to 3 minutes, you should be able to prevent fibrosis.
I have some general injection questions that we're going to start off with. The first question here is, how long should one injection last? And I believe they're referring to the duration of erection.
Yeah. So I always, if you remember the commercials that they used to have on TV for Viagra and Cialis, right? They always said, if you have an erection that lasts longer than 4 hours, call your doctor or seek medical attention. That actually is a pretty rare occurrence with Viagra and Cialis, but can commonly occur with these injections. And that's the real risk of using these injections. So, the goal here is to have an erection that lasts long enough for you to complete, sexual activity, but resolves on its own by about 3 hours. The problem with having a prolonged erection, as exciting as that sounds, is that you're not getting new oxygenated blood into the penis while you're erect. And so the longer that goes on, you're not supplying that tissue with oxygen. And, the tissue needs oxygen to survive. So, I always tell people to shoot for a 7 to 9 erection that will go down on its own by about hour 3.
Alrighty. Next question here, kind of a little bit of a follow-up, but this person says they're having trouble to keep the firmness of the erection when they go from standing up to lying down on their back. Looking for any suggestions on what this is and how to fix it.
Are you talking about with use of these injections or just in general?
It says they're using ICI medication and they notice that they're having trouble keeping the firmness of the erection when they go from standing to lying down. I think they're referring to venous leak. That's something we tend to see.
Yeah, so I would say you could try to tackle that a couple ways. You could certainly try to increase the amount that you're injecting. It might make you more rigid and help kind of stop any potential leak that might be happening. You could also use these injections in combination with like a constriction ring, and that can be pretty effective, it's essentially a ring that goes at the base of your penis, kind of compresses it so that once the blood gets in there, it stays there. And that can be very helpful for patients who have problems maintaining, especially if it's sort of positional.
Alrighty. Let's see here. Next question here is kind of a general one here. Can someone get over ED after using injection therapy, or is this more so of a tool to aid erectile dysfunction?
Yeah, I would say the latter. So this is a treatment for erectile dysfunction. Using these injections will not reverse the process. But these are very effective tools for helping people get a better quality erection who may have, been struggling with using oral medications or other treatments. These can be very effective.
Alrighty. And then one last question before we go back into purely injection questions. This one is, what is the difference between ICI and gel injection, or IU gel, into the tip of the penis? So
it's a good question. So IU gel is not injected. It is usually a vasoactive gel, so a gel that has some of these ingredients that are in bimix, trimix, and quadmix. And rather than inject it into the shaft of your penis, you insert the tip of the syringe, which does not have a needle, into the urethra, which is the hole that you pee from, and basically squirt this gel into the urethra, and then it gets absorbed through the urethra into the nearby erectile tissue. And that can be useful for patients who, are really unwilling or unable to give themselves these injections. It's just another strategy at delivering a vasoactive substance into the penis directly.
Alrighty. Next question here. How much of a factor is the use of alcohol in the injection/erection process? So two-parter there.
How much, sorry, say that again. How much of an
Mm,
effect is alcohol related to
al-
what?
How does alcohol affect the effectiveness of injection in therapy?
Um, I would say so. Alcohol is definitely, the term whiskey dick exists for a reason. It's not great for sexual function. It can make it harder to get an erection. It can make it harder to stay hard. It can make it harder to ejaculate. Um, and it certainly can make the oral medications less effective. These injectable medications are pretty strong, and they're being injected directly into the penis. So, if you find something that's really effective for you, while I wouldn't encourage you to drink alcohol while using them because you're going to increase the risk of breaking a needle, injecting incorrectly, hurting yourself, I don't think that alcohol would have as detrimental of an effect on the use of these injections as, say, taking an oral medication like Viagra or Cialis. But in general, you want to, have all your wits about you when you do these injections. You don't want to do them under the influence of anything because the needles are very small, but they can bend, they can break, and if you're going to be doing these injections, you want to make sure that they're effective.
Alrighty. Next question here. How do neuropathy and diabetes affect the injection process or effectiveness?
So there, people who have diabetes and or neuropathy from either diabetes or other causes are actually great responders to these because one of the problems that happens in diabetes is you get vascular dysfunction, and then also if you have a neuropathy, sometimes that can make it harder to become aroused. The nerves that we talked about at the beginning that sort of tell the arteries to dilate to get blood in there. Um, don't work as well. And so these medications are kind of bypassing that nerve system and just going directly into the penis and directly dilating the blood vessel. So some of my diabetic patients are the best candidates for these kinds of injections.
Alrighty. Next question here. Should injection therapy be the last alternative for ED solutions?
I don't think so. I mean, I think it just depends on whether or not this type of treatment makes sense for your life. I mean, I have very young patients on these because for a variety of reasons, some who have terrible, insulin dependent diabetes and had it for a long time and have premature vasculogenic erectile dysfunction. I have other people who, do OnlyFans or work in the adult industry and need to be hard on demand. And sometimes the pills can be unreliable. And so I think that there are lots of different types of people that are good candidates for this. I don't think it should be thought of as like a last resort. My goal is always to give people the tools that they need to have a more satisfying sex life. So if they're not responding to pills or finding them unreliable, as long as we're going through the steps in my office to figure out, which injection is right for them and teaching them how to do it safely, then I think it's just another tool in our, tool shed that we can provide patients to get good quality erections.
Certainly. Alrighty. Next question here. This person's looking for some advice about how you mention this to your partner. I guess it kind of ruins some of the spontaneity that goes along with sexual intercourse. So do you tell your partner soon, later, or not at all if you're using ICI therapy?
That's a good question. I think it's hard for me as a provider to answer that because I think it just really depends on your relationship with your partner. As a general rule, I encourage patients to be as open and frank with their partner as they can be. I wouldn't encourage someone to hide something from their partner. That said, I do have men in my practice who use these injections and don't tell their partner. Where I find it is challenging for some guys is when they are single and maybe have more than one partner. Maybe they're going to go out on a Saturday night and they hope that they meet someone and they have trouble kind of navigating how they incorporate these injections into that kind of, romantic and or sexual situation. I think that can be a little bit challenging. It's not impossible, and I certainly have a lot of patients that do it successfully. But I think if you're in, a committed relationship, you have a good relationship with your partner, it might actually help them. It might make them feel better, understanding that, you're using these injections because you need to, that this is a medical condition that you have, and this is the solution for that. And bringing them into that sort of conversation and will help them understand what you're going through, and I think can actually uh, help them just understand better what's happening. And I'm always for sort of open communication, but I do recognize that some patients use these in scenarios where that can be challenging. So I try to give them tips on how to navigate that, whether they like preload a syringe before they go out, if they're expecting to meet somebody, or newly dating someone where they don't feel comfortable having this conversation. I think at some point, hopefully, they get to the point where they do feel comfortable with that person and can share it with them.
Alrighty. Well said. Next question here. What are the main reasons why injections don't always work?
The main reasons that I see are poor injection technique. So we'll often do, as I mentioned, a test dose in the office. If I get someone coming back, we usually see patients back 4 to 6 weeks after we start them on these treatments. If they come back and they're saying, I'm finding it unreliable, I injected the same thing that you gave me here, but it doesn't seem to be working. I ask them, we review the steps again of how to inject. I ask them if they've seen bruising, or if they have met any resistance when they're trying to push the medication in, because that often is a sign that they're not injecting properly. And so we will just review that again. Another reason might be that the injections are not, appropriately strong for them. Maybe they were prescribed them without having had a test injection in the office, and so what they're being prescribed may not be strong enough for them. But in my practice, because we're doing that, that's all figured out in the office, and I can feel pretty confident that whatever we prescribe them should work. So in most cases, when I see, that these injections are not working for people, it's because they're not doing them correctly, and just reviewing that with them can often make people more successful when they try again in the future. I have also seen patients who, use these injections probably more than they should, over long periods of time, can sometimes lead them to be less responsive to certain strengths. And over time, they may have to increase to stronger mixes. These again are patients, as I mentioned, that are maybe working in the adult industry, or OnlyFans content creators or something, and they're having sex every single day, multiple times a day, and are probably using their injections too often. But I think if you stick to kind of the rules that we laid out earlier, and you're doing it no more than 3, maybe 4 times a week, you're following the instructions, you're doing a test dose in the office, these are pretty successful.
Alrighty. Next question here. Does injection therapy, ICI, lower blood pressure like Viagra?
No. So it's a locally acting medication, unlike Viagra and Cialis. So Viagra and Cialis are pills you swallow. They get metabolized by the liver. They essentially can have effects all over the body, including lowering blood pressure. This is going directly into the penis, and so it's acting locally, and does not have other systemic symptoms. So it doesn't really affect your blood pressure. It, people can experience facial flushing with pills, nasal stuffiness, headache, blurred vision. None of that happens with the injections, which is another reason that we really like to use them if patients are intolerant, or unresponsive to oral medications.
Alrighty. Next question here. Does any ICI mixture have less fatigue than another after usage? So I guess they're feeling sore or tired after injecting.
Interesting. I know that, Trimix has that third ingredient, alprostadil. There are some men that can be kind of hypersensitive to that ingredient, and they'll report feeling like almost like an ache in their penis. And as you increase the amount of alprostadil in the mix, that can intensify. So I'm assuming that's what they're referring to when they're saying fatigued, or but is that you can experience some kind of achy sensation in your penis, if you're using a mix that has alprostadil. I would say one option would be to explore possibly using a different mix where that alprostadil number is lower. You might find that you experience less discomfort.
Alrighty. Alrighty. I know we just mentioned that you have some clients that maybe inject too many times a day. So this question is, how many times in a day is it safe to inject? Is there a specific number or amount?
Yeah, I mean, in general, excuse me, I tell patients not to do it more than once in 24 hours.
Yeah.
I think that's best practice. If you are having a romantic weekend away, you can plan to inject every day of that weekend, but you really should not, even if you want to have sex a second time, there are other ways to have sex that you don't necessarily need these medications for. And so, I encourage my patients to not do it more than once in a 24-hour period.
Alrighty. Next question here. Saw this a few times, worded many different ways, but why might my injection results differ from time to time?
Good question. I think that gets back to also technique, in that at least in my practice, that's what I've seen, is that when patients find that the medicines are not working the same every time, that they may not be injecting properly every single time. So again, we just review the technique in my office. And then the only other time I see it is again, if they've been using these injections for a long period of time, sometimes they will over time have to use some stronger mixes.
Alrighty. Next question here. How do you recommend I travel in the air with this drug since it needs to be refrigerated?
That's a good question. So your doctor can write you a note. We do that for our patients quite a bit. You need to keep it, on ice essentially. So you can buy little ice packs that you can travel with as you go through TSA. If you provide them a letter from your doctor saying that this is a prescribed medication and that you need it for a medical condition that you're being treated for, they might look through your supplies, but they shouldn't have a problem letting you on the plane with it. I generally encourage patients to carry it on as they would if they had to, inject insulin or use other medications that have to be refrigerated. You should take it with you on the plane. I would not necessarily put it in a checked piece of luggage.
Alrighty. Next question here. When using injection therapy, why does my penis seem to shrink when flaccid?
Well, I mean, everybody's penis shrinks after, they ejaculate and the whole process reverses. I don't know why specifically that would happen with injection therapy. It may just be because, your tissue is just maximally expanded, and you get some natural retraction, and maybe that's more pronounced because your penis is really, really stretched out and engorged when you use injection therapy. But I don't think it's indicative of any sort of serious issue.
Alrighty. Moving along to some injection technique questions here. So first question, why might my injections be so painful?
I think this probably has to do, well, a couple of things. It could be that you're not injecting properly. But again, going back to kind of what we talked about with the alprostadil component of trimix and quadmix, that medicine for some men can be very sensitive to it. And so if you're experiencing a lot of pain, and it's not just at the injection site, but it just feels like your whole penis kind of hurts, you may need to consider switching to a different mix that has a lower amount of that alprostadil medication.
Alrighty. Next question here. Why do I get dark bruises from some of my injections?
I think that's probably technique. So you really shouldn't get bruising if you make sure, I mean, again, what I tell patients to do is, if they're injecting, make sure you're creating a dimple in the skin as you inject the medication. That will make sure it goes into the erectile tissue and not just underneath the skin. And another thing I see is patients will, take this little tiny needle and they'll very slowly insert it into the penis as they're injecting, maybe because they're scared, and they do this, and they go very slowly. That creates little micro traumas as you're putting the needle in. So going back to what I said before, I tell them to put it very close to the skin, count 1, 2, 3, and then push it in as quickly as they can. Oh, sorry, you didn't see that. Okay, 1, 2, 3, push it in as quickly as you can. And then inject the medication and pull out as quickly as you can, and then squeeze. If you do that process, if you put the needle in quickly, if you remove the needle quickly, and if you squeeze, you really shouldn't be getting any bruising.
Alrighty, and just as a follow-up, I guess, for that technique question, should you be able to see the needle or any bit of the needle when you're injecting?
No, in general, you should not see any part of the needle, and that's where that dimple becomes really important. If you can create enough pressure with pushing it in where you create a dimple in the skin, then the needle should not be visible, and you'll know for sure that you're in the right place.
Alrighty. Next question here. This person wants to know if you have any suggestions to overcome the fear of bleeding while injecting themselves. So maybe telling them they don't bleed so much as they think they might.
Yeah, I mean, again, if you follow the technique that we went over today, you shouldn't have any bleeding. So, if you are putting the needle in quickly, administering the medication, pulling the needle out quickly, and squeezing for 2 to 3 minutes, you really shouldn't have any significant bleeding.
Alrighty. Is it possible to have a needle that is too long that may inject into the urethra? And if this occurs, is that an issue?
Yeah, so injecting into the urethra is a bad thing. You want to avoid that. But it doesn't really have anything to do with the needle size. I mean, assuming that you're using like the typical needles that we prescribe for this, which is usually, like a 5/16 inch needle. It's very, very small. Um, it's more about where you're placing the needle. So if, you go back to our diagram here, if you're going at 1 to 3 o'clock, right, you shouldn't be getting anywhere near the urethra, which is at like 6 o'clock. So injecting on the sides is going to guarantee that you don't get into the urethra, but that is a serious issue. I mean, if you inject if you put the needle in the urethra, you can create problems. You can have blood in your urine. You can create scar tissue in the urethra. Can introduce infection. So you want to avoid that. But if you follow that 1 to 3, 9 to 11, clock injection technique, then you really shouldn't be anywhere near the urethra.
Alrighty. Next question here. Why do some parts of my penis stay thick and painful long after ejaculating? Is there any remedy for this, or is it simply a technique issue?
Why did what was it? They said painful, and what was the other?
I guess thick, so it seems like he's still engorged after ejaculating.
I don't know. I mean, without kind of understanding more about
Yeah.
what they're asking, your penis the pain might be related to the medication, as we kind of talked about a couple of times. Um, I have found that patients, if they maybe ice the area, it can help with that discomfort. I'm not really sure why only a portion of the penis would remain, firm and painful. That might be the sign that you're not injecting correctly, because really it should, if you're using good technique and using the right, amount of medication and the right strength, should act very similar to a normal erection when it resolves.
Alrighty. Next question here. Saw this a couple times. So someone that might have some scar tissue from using this for a very long time says they have issues with not bending the needle. Do you have any suggestions for
That's tough. I would try injecting at a different site, because we see the formation of these kind of plaques or scar tissue when patients over and over and over again inject the same site. So I would say try rotating maybe to the other side, or going, just distal, like closer to the head, or just a little bit farther back from it. As a general rule, I tell patients to inject on the sort of bottom half. So like from here down. You don't want to get too far out towards the head of the penis, because the corpora narrow there, and you're more likely to hurt something or hurt yourself. But if you can maybe adjust where you're injecting so that you're not going into that scar tissue, that will, increase the likelihood that you don't bend the needle. Sometimes using a little bit of a longer needle might make it easier also, or using a thicker gauge, but you don't want it to be too thick and you don't want it to be too long, because it's going to be more painful if it's a thicker needle.
Alrighty. If I don't get the desired result from the first injection, can I administer a second dose on the other side?
That's tough. I generally tell patients not to. I tell them to just come back another day, come back tomorrow and try again. That said, when people are first kind of figuring out how to do this, I think there's a lot of error that happens at home. And so if you're pretty confident that it didn't work at all, then it's probably okay for you to try again. But I would definitely wait like a good 30 minutes to an hour, because sometimes what can happen is people don't get like an immediate effect, and then like shortly thereafter they start to get an erection again. So I wouldn't, do it and then 3 minutes later say, oh, this didn't work, and then do another injection. Give it some time and see what happens. Or certainly if you see a bruise, form where you gave yourself the first one, then you probably think, okay, well, this injection didn't go properly. Um, then at least at the beginning, when you're kind of figuring all of this out, I think it's probably okay to switch to the other side and try again.
Alrighty. Let's see, what question next? Next question here. Does the angle of the needle make a difference? So I know you were demonstrating some specific angles there. Maybe we could just review that.
Yeah. So I always tell people it should be 90 degrees to the surface of the skin. So if you're coming, from this angle, you want to go 90 degrees to the surface of the skin. If you're coming from this angle, 90 degrees. Same over here. So 90 degrees would be there, 90 degrees would be there. So that you always want to shoot for that sort of perpendicular to the surface of the skin.
Alrighty. Next question here. Is it better to stand while developing an erection after the injection?
I think it depends on the person. I always show patients in my office, they sit at the edge of the exam table to give themselves the injection, or they do it standing. But I don't think in terms of effectiveness, it doesn't really matter. Sort of whatever you're comfortable. If you have a big belly, it might be harder to see. And so sometimes standing can be easier. So it just kind of depends on your body type and what you find it easier to do.
Alrighty. Next question here. Saw this a couple times. A lot of people wondering about the preloading syringe method that was mentioned. Does that need to be kept in the refrigerator, or can this be left at room temperature? One of the biggest questions is it dangerous, or how long can it be out of the fridge for?
So these injections are meant to be injected. You take the medicine out of the fridge, you draw up the medication, and then you inject, almost immediately. Most of my patients that do this sort of preload syringe thing are doing so with Bimix, which is a little bit more stable when it's not kept in the refrigerator. Trimix tends to be less stable, but I would say if you're using these injections within like an hour or so of taking them out, that you should probably be fine. The reality is that these medicines don't turn into poison if you keep them out of the fridge. They just become less effective. So you don't want to preload a syringe and then throw it in your bag and use it 3 weeks later, because it's not going to work. But if you're preloading a syringe and taking it out with you on a date, and you have the opportunity to have sex within a couple of hours of preloading the syringe, it will probably be pretty effective.
Alrighty. Moving right along. So trimix versus quadmix. MenMD released quadmix recently, and we have had some questions about that. So generally speaking, what is the main difference between quadmix and trimix?
So it's just another treatment option. So it's equally effective as trimix. It's just another option for people to try if they are finding trimix unreliable. And the quad refers to the fourth ingredient, which is atropine, which is sort of another vasodilator. But there's not any evidence necessarily that it works better. It just works differently for patients. So you could think of it kind of as like Viagra and Cialis, right? Both medicines work well for most men, but for a variety of reasons, some men might respond better to one versus the other.
Certainly. Next question here. How do you determine what dose to start off with?
It's a good question. Personally, I would say years of experience. I've been doing this for a very, very long time. So I base it on what a man tells me about his erection. Is he getting spontaneous erections? Is he getting morning erections? Has he tried pills? What happens when he takes pills? Do they work? Do they not work? Do they sometimes work? And is he having trouble getting hard, staying hard, or both? Knowing that kind of history, asking about prior injury, will kind of help me guess where to start. But again, we're always doing these injections first in the office. And so if I inject them in the office and they don't get a great response, then I can just give them more in the office or a different mix until they do get a good quality erection. And then I can sort of confidently tell them based on their response in the office what they should be injecting at home.
Alrighty, certainly. Next question here about dosing. Do I need to keep up my starting dose to get the same results, or is this something that will gradually increase as the more I use it?
In most of my patients, they find a dose and they're pretty stable with that for long periods of time. It's really only in the guys that are using it more than they probably should be, and or maybe someone who has venous leak, um, where we see over time them requiring more amounts, a larger dose and or higher strength of these mixes. But for the average guy, once you find them the right mix and the right dose, a lot of them will be stable on that for a long period of time.
Alrighty. A little bit of a follow-up there. So this is a follow-up to the question you just answered, and also before we were talking about venous leakage and laying down, sorry. You mentioned increasing the dosage, but this person wants to know if a constriction band or ring would also be a solution to fix such leakage.
So a constriction band is not a fix to the leak, but it can help minimize the leak. So the venous leak occurs usually because there's some defect in the erectile tissue that is not allowing for it to fully and rapidly expand. So that if you don't get that full rapid expansion, you don't get compression of the veins, at least not complete compression. And so blood leaks out of the system. There's not a way to fix that per se. But what the constriction ring does is at the base of the penis here, it's a ring that squeezes the penis so that whatever blood would leak out, some of that stays in the penis because it's being compressed and is not being let out of the penis. So it doesn't fix the problem, but it can help minimize it.
Alrighty. Got some questions here about mixing intracavernosal injections with other modalities. So the first one here is, can I take Viagra or PDE5s with injection therapy?
You certainly can. I don't think it's necessary. I mean, most of the time, if you're getting a good effect from these injections, you really shouldn't need the pills. They're not really doing much. The bulk of the work per se is being done by the injection itself. Mixing them would also potentially increase your risk of developing priapism, which is one of those erections that doesn't go down. So, in general, I encourage my patients to not mix pills with the injections for those reasons. If you have been prescribed phenylephrine by your physician, which is essentially the antidote or the reversal medication we inject when someone does have priapism, then at least you'll be safe if you do develop that because you're mixing modalities. But in general, I tell patients to try to avoid that if possible.
Alrighty, and a little bit of a follow-up to that is, what is the ultimate home remedy if for some reason your erection does not go down after sexual intercourse is complete?
Well, I would say, wait the 3 hours. Sometimes these medicines are very effective and people will ejaculate and their erection won't go down immediately. But if you're getting past that 3 hour mark and it's not going down, or your penis is starting to really hurt, and it's still very, very rigid, then, hopefully you have been prescribed these medications by a provider who's very familiar with them. I always prescribe phenylephrine, which is the antidote to any of my patients who are getting these mixes, because I don't want to ever have them end up in a situation where they have an erection that doesn't go away. Some people will talk about taking over-the-counter Sudafed, which is a vasoconstrictor. If you have true priapism, it's very unlikely that Sudafed would work, but it's certainly something you could try. My best recommendation would be, if you're getting to 4 hours and your erection is really very rigid still, and you don't have access to phenylephrine, to seek medical attention as quickly as possible. Because one of the things that we see in my field is guys are embarrassed that this happened, and will often avoid going to the emergency room for hours and hours and hours, or they'll take Sudafed and wait another 3 hours hoping it gets better. And that is a much harder problem to fix. If you get to the hospital at, hour 4 and you have someone evaluate you and reverse your erection within, an hour or two, you have a very good chance of being able to reverse that process. If you go 7, 8, 24 hours, I've seen patients come in later with an erection. That often is non-responsive to phenylephrine, and we often have to use more aggressive measures, either draining your penis of the blood, sometimes taking patients to surgery. So, priapism is a very, very serious thing. And if you don't have access to phenylephrine at home and you're getting past 4 hours, the best thing you can do is just seek medical attention as quickly as possible.
Alrighty. Jumping back to some of those injection therapy and other modality questions, this one's a little bit of a follow-up. If I do happen to use injection therapy with Cialis, how long should I wait to inject after the Cialis?
Well, Cialis lasts for 36 hours, so I don't really think that there's not a time that you need to wait, because once you take it and it's active, within 30 to 60 minutes, it's going to be active for 36 hours. So there's not really like a recommended amount of time that you would have to wait after taking that medication. I think if you're trying to see if the Cialis alone is effective, then you should give it a full, 1 to 2 hours to see if it's effective. And if it's not really doing the job for you, then at that point you could consider maybe giving yourself an injection.
Alrighty. Next question here. How long should I wait to see the results of an injection?
The injections are pretty quick. So in the office, when we do our injections, I give them the injection, I leave for 5 minutes, sometimes up to 10 minutes, and come back. And if they're going to respond, they should respond within that amount of time. So usually within a few minutes, as long as you're stimulated or stimulating yourself, you should see a pretty quick response.
Alrighty. Got time for a handful of questions here. So next question here is, what are the effects of ICI on the kidneys, if there are any, to be known?
None that I'm aware of. Again, this is a kind of a locally acting medication, so it's just acting in the penis where you're injecting it. So it really shouldn't have any effect on your other organs.
Alrighty. Next question here: can bilateral corporal leak be repaired?
No. So usually, as I mentioned, that is a function, it's sort of a defect in the erectile tissue. So it can't be repaired surgically. What men can have is a penile implant, which is the sort of gold standard for someone with, moderate to severe venous leak, because what that surgery does is it replaces the defective corporal tissue with an inflatable device. So there's not a surgery that can fix the leak, but a penile implant surgery basically overcomes that problem because it's replacing the defective tissue with an inflatable device.
Alrighty, next question here. So this a couple of times. Can these injections cause internal discomfort, such as soreness, after or during intercourse?
Yeah, definitely. Again, going back to that alprostadil component. So that's the key. When we see patients experience discomfort or achiness during sex, that doesn't seem like it's related to the injection, but it's sort of like a generalized pain or discomfort in their penis, sometimes which can be made worse from the friction or pressure that happens during sex. That is usually related to the alprostadil. And in those patients, they might want to consider bimix. They may want to look for maybe a quad mix or a different trimix that has less alprostadil in it.
Alrighty. Let's see. Next question here. This person says they're having issues with the medication taking longer or needing multiple doses. Could this be caused by scar tissue or blood pressure meds, or do they simply just need to increase their medication?
It's a good question. I think without knowing more about the situation, I would say if it's taking longer for them to respond, then yeah, they might want to consider increasing how much they're injecting and or going up in their strength. I would want to know more about how often they're using these medications, make sure that, of course, they're doing these injections correctly. It really shouldn't be influenced by blood pressure medications. So it may just be, a technique issue. It may be that you need more of what you're already using, or it may be that you need something stronger.
Alrighty. Got time for about 1 or 2 more questions. So next question here is, can I inject after using a VED?
Yeah, I mean, assuming that you're not that there's not any sort of visible trauma, which can sometimes happen with vacuum erection devices, you should be able to inject, you know, just like you would without using a vacuum erection device. One thing that can happen though is your penis can almost get swollen after using these devices. And if you get edema underneath the skin, which is sort of like swelling, you know, it's kind of similar to the swelling that you get in your legs after a long day, then that is putting like a thicker barrier between the needle that's going through the skin into the erectile tissue. So pumping beforehand might make it harder for that needle to get into the erectile tissue where it needs to go. So in general, I would probably recommend that patients not do it, but you know, you certainly can do it. You might just have to consider using a longer needle if you're getting a lot of swelling from using the device.
Certainly. Alrighty, and the last question here, saw this one a couple of times. So following a radical prostatectomy and they're non-responsive to PDE5s, would this therapy be helpful in obtaining an erection?
Yeah, yeah. It is a great solution for post-prostatectomy patients. In fact, we do a lot of penile rehabilitation in my office. So patients are often put on PDE5 inhibitors, daily Cialis, prior to their surgery, and will continue that afterward and they can certainly use on-demand dosing afterwards as well when they want to try to have sex, like a full dose Viagra or Cialis. If they are non-responsive to those, you know, as quickly as possible, I talk to them about using these injections. And sometimes, even if they're not in a situation where they're having sex regularly, I'll sometimes have them use these injections 2 to 3 times a week just to masturbate. Because what it's doing is it's vasodilating the blood vessels into your penis. And the goal with this rehabilitation model is to get as much blood into your penis as possible, as often as you can, to try to prevent long-term erectile dysfunction and atrophy of the penis, where you can actually get shortening or shrinkage of the penis because you're not getting a healthy amount of blood flow to the area.
There will also be more resources in the Resource Center. You can go to menmd.com to view instructional videos, guides, expert articles, and more. Fun thing about menmd.com is we just added a search bar function in there. So if you heard about any products, any treatments, or anything related to ED or injection therapy, and you'd like to find out more about it, you can simply go to the website, find the search icon on the top right corner, and type in your keyword. You can also call MenMD at 857-233-5837 or log into the MenMD portal to schedule an appointment with a MenMD personal health assistant. If you're interested in purchasing any of the injection accessories, you can learn more or purchase these on the shop page on menmd.com.